दुनिया भर में बढ़ते मंकी पॉक्स के मामले चिंता बढ़ा रहे हैं। ऐसे में केंद्र सरकार भी लगातार मंकी पॉक्स के मामले पर नजर बनाए हुए है। एनटैगी चेयरमैन डॉक्टर के अरोड़ा के मुताबिक मंकी पॉक्स के मामले कोविड की तरह संक्रामक या गंभीर नहीं है। हालांकि एनटैगी प्रमुख ने कहा कि इसका इन्फेक्शन चिंता का विषय है। सरकार ने कोविड की तरह मंकी पॉक्स के मामलों पर निगरानी के लिए विशेषज्ञ समिति का गठन किया है। आपको बता दें कि लगभग 20 देशों में मंकी पॉक्स का प्रकोप देखा जा रहा है।
There are two things. One is monkeypox is not as contagious as COVID. Similarly, the disease is also not as severe. But the important point is that it spreads and it is a matter of concern, and it is likely to have more severe outcomes in those who are immunocompromised or have other diseases. So the government has set up a full committee, expert committee for this. Similar kind of surveillance which COVID was doing, this is framework of surveillance is to be set up for this monkeypox, so that if there is entry of any monkeypox case or virus into the into the country, that is quickly picked up, and this can be stopped by good quarantine services.
मंकी पॉक्स के मामलों से पश्चिमी और यूरोपीय देशों में चिंता बढ़ी है। भारत में भी इस बात को लेकर चिंता बढ़ रही है। भारत में मंकी पॉक्स को लेकर क्या तैयारियां हैं, उसे लेकर मेरा नाव ने राज्य के स्वास्थ्य अधिकारियों से बात की। हमारे सहयोगी नेहा ने कर्नाटक के हेल्थ कमिश्नर डॉक्टर रणदीप से इस बारे में बातचीत की।
This is something that we've possibly not really seen, and now that it is coming up, how much do we know about this disease per se, and what do our doctors today on ground really know about this? If at all there is a case, are we prepared to sort of tackle this?
We know that monkeypox is endemic to certain African countries. We're seeing a huge number of cases in Congo and some other African countries. It has also spread to certain non-endemic countries in Europe. And Asia also. What we need to look at closely is in terms of how transmissible it is, and also in terms of what kind of treatment and hospitalization that it would lead to. Looking at both aspects, we had also asked TAG to review it yesterday, and they've also gone through what could be done. And largely they have said that it is far less transmissible than COVID, because monkeypox would require sustained contact, probably a salival exchange, sometimes even very close contact. Only then it spreads. Unlike COVID, which can even spread even if we are at probably a feet or 2 feet distance. So that's the silver lining. And apart from that, the other advantage that it has over COVID in terms of recognizing it early is the visible symptoms. So one gets rashes, the boils. So physically we are able to make out if somebody is having those symptoms or not. Much easier to recognize at the airports, at the railway stations, at the borders, in case any such instances are detected.
Doctors on ground, so be it in the districts or in Bangalore for that matter, are they being given any sort of training right now, any sort of awareness about what this is? Because again, this is possibly something that we've not seen earlier, at least in India.
So we'll be taking that up this week. Already written instructions have gone, but you're right, in terms of actually a video conference and to actually tell them what are the lookout symptoms, what kind of treatment, which cases require isolation, which would require just supportive treatment.
महाराष्ट्र के स्वास्थ्य मंत्री राजेश टोपे ने राज्य में मंकी पॉक्स की तैयारियों पर मेरे नाव से बात की। स्वास्थ्य मंत्री ने कहा कि राज्य में फिलहाल मंकी पॉक्स का कोई मामला सामने नहीं आया है।
At present, I'm very actually the data which is available with me shows no suspects and no confirmed cases of monkeypox. So there is nothing to worry as such, but we have to take precautionary actions. So airport authorities are screening the passengers coming from epidemic and non-epidemic countries showing outbreaks. Second point is for isolation of suspected cases, separate ward at Kasturba Hospital is prepared, and their testing samples will be sent to the NIV Pune laboratory. all health facilities of Mumbai are being informed to notify and refer any suspected case to Kasturba Hospital. So these are some of the three measures which has been taken by the MCGM.
What kind of advisory has been issued in regards of precautions that needs to be taken, if you could inform our viewers?
At present, I think basically we are just screening airport and we are now ready and kept with the some wards specially, and doctors have been made alert about this. There is nothing to say much to the people at large.
So we have seen the phase of COVID as well. So does this virus, you think that it will be more impactful than COVID?
Not at all. This is not actually spread through air. It is a virus which only can infect through touch, like touch to the body, human to human. So I don't think there is much threat from this virus, but still we have to be always alert.